Module Overview. This module delves into the sensitive, clinical, and practical aspects of identifying trauma in individuals through screening, comprehensive assessment, and handling disclosures with utmost care, respect, and professional responsibility. Trauma screening and assessment are not about diagnosing mental health disorders, but rather about gathering essential information to tailor care, avoid retraumatization, and improve outcomes. However, these activities must be approached within ethical, legal, and trauma-informed frameworks that protect the client's autonomy, dignity, and emotional safety. The module further explores how, when, and whether to ask about trauma experiences, how to document trauma histories respectfully, and what to do when individuals disclose past trauma spontaneously or during service engagement. Understanding screening versus assessment trauma screening. A brief, structured process used to identify the possible presence of trauma exposure or trauma-related symptoms, usually conducted using standardized questions or forms. Purpose: to flag individuals who may need further assessment or support, not to diagnose. Trauma assessment: a comprehensive and collaborative process of gathering in-depth information about the person's trauma history, symptoms, functioning, and needs. Often involves clinical interviews, behavioral observations, self-report tools, and collateral information. Purpose: to inform treatment planning, risk management, and referrals. Trauma screening and assessment must be done with informed consent, cultural sensitivity, and readiness to provide support afterward. Validated screening tools and frameworks. Screening should use evidence-based tools appropriate for the population and context. Some common examples include ACES, Adverse Childhood Experiences, Questionnaire, TSQ, Trauma Screening, Questionnaire, PTSD, Checklist for DSM-5, PCL5, Life Events Checklist, LEC, Trauma-Informed Organizational Assessment Tools for Children or Adolescents, Child and Adolescent Needs and Strengths, CANS, Trauma Symptom Checklist for Children, TSCC. For healthcare environments, primary care, PTSD screen, PCPTSD, behavioral health screening tools. Always ensure tools are adapted to language, literacy levels, and cultural norms of your service population. Approaching trauma discussions with clients. Trauma-informed conversations should be client-led whenever possible. Use open-ended, non-judgmental, and non-invasive language. Avoid why questions that imply blame. Give the client the right to opt out or pause the conversation. Clearly state why you are asking about trauma. Trauma-sensitive phrases to use. Sometimes people go through difficult experiences that can affect their well-being. Would you feel comfortable talking about that? Only share what you feel safe sharing today. You're in control of what we discuss, and you can stop at any time. Ethical handling of disclosures. When someone discloses trauma, stay calm and grounded. Listen without interrupting. Validate their experience. Avoid rushing to fix or explain. Reassure them that they are not alone. Do not ask for unnecessary details unless clinically required. Validation examples. Thank you for trusting me with that. That sounds really painful, and I'm sorry you went through that. I believe you, and I'm here to support you. Documentation, confidentiality, and referrals. Document only what is relevant, necessary, and trauma-sensitive. Avoid graphic language or speculation. Use neutral and factual terms. Client reports history of physical abuse, rather than client was beaten repeatedly. Inform clients who will have access to their records. Maintain strict confidentiality unless there is a risk of harm to self or others. Follow safeguarding laws. Referral pathways should be warm, not cold handoffs, culturally appropriate, clearly explained to the client, followed up with compassion and consent. Organizational readiness for trauma inquiry. A trauma-informed organization will train all staff in trauma sensitivity, ensure safety and privacy in intake areas, have clear protocols for managing disclosures, provide staff debriefing and support, integrate TICB principles into electronic record systems and policies. Cultural and intersectional awareness in trauma inquiry. When inquiring about trauma, intersectional identities such as race, religion, immigration status, disability, and gender identity must be respected. Avoid assumptions about what is traumatic or how it is expressed. Understand that some cultures may minimize disclosure due to stigma, language barriers, or beliefs about mental health. Accreditation bodies such as WHO, NASW, APA, and Joint Commission all emphasize cultural humility, informed consent, and client autonomy in trauma practices.